Hey everyone, my name is Dr. Field from Hulsevus Rockford Chiropractic, and today we're going to team up with Movement Fitness again to talk to you a little bit about your IT band. Now, your IT band is known as the iliotibial band, and it goes from the top of your hip and goes down to your knee. Now, the nerves that come out of your lower back, the L4 nerve, the L5 nerve, and the S1 nerve, then form the inferior gluteal nerve, which tells your IT band to function. The IT band is a continuation off of a small muscle up in your hip called the tensor fascia lata muscle. A piece of fascia runs off of that muscle down your leg to your knee, and that is known as your IT band. Even parts of your gluteus muscles up in your hip may even attach to that IT band. Tight IT bands can cause some external rotation of the hip, which then in turn causes internal rotation of your foot, which can alter the way that people walk. So a tight IT band is also found more common in women compared to men, just based on their pelvic structure. Their increased Q angle, which is the angle from your hips to your knees, makes women a little bit more susceptible to IT band issues. Now, those issues that someone might have within a tight IT band would be maybe some low back pain, some hip pain, or even some knee pain as well. Now, a lower back adjustment or pelvic adjustment can help relieve the stress on the IT band and the nerves that come out and take care of it. The adjustment then can help with their overall pain levels, can increase a person's gait or the way they walk, and increase their just general range of motion. So now, let's go down and talk to Justin down at Movement Fitness so he can show us a few ways to take care of our IT band and help us get through IT band issues.
Hey guys, it's Justin. We're going to take a look at the IT band and how we can stretch it and strengthen it and make it feel better. See, this is a common injury in runners, but it can happen in anyone. Generally, an issue with the IT band is something that comes from the hip. So we want to begin to work to help lengthen that tissue quality so we can prevent this injury from occurring in the future. So we're going to do three things. We're going to look at a foam roller. Number two, we're going to look at stretching. And number three, we're going to look at how we can begin to strengthen the hip and glute area so we can prevent this injury in the future. So we're going to take a standard foam roller like this. What we're going to do is we're going to set this right above our knee on the affected side or both sides. Now, we're going to get down on our elbow. We're going to roll back and forth right across the IT band, okay? We're going to do this about 8 to 10 times. You can do this multiple times a day if you're having an issue. Now, it's not going to feel super great, but it is something that can help to relieve some of those issues and some of that inflammation to help increase the tissue quality. Now, the other thing we're going to do is we're going to stretch. So you can take a band, a strap, a belt, anything that you have. We're going to lay down on our back. Now, we're going to take this and we're going to wrap it around the ball of our foot. We're going to bring our leg on up. Now, we're going to keep the opposite side toes straight to the ceiling. We're going to pull this band here. We're going to relax all the way down, and we're going to pull our foot ever so gently to the other side here. The key to this stretch is to make sure you keep your butt on the ground, both sides. Don't pull it so far over that your butt comes off the ground. We want to get here, we want to pull it over, and right about there, you're going to feel a stretch right along the side of your leg and your hip, and that is your IT band. So we want to do that. So we're going to roll, we're going to stretch, but then one of the things that we recommend is to strengthen. Obviously, a strength training program is super beneficial for this, but one of the things that we can do that is pretty inexpensive is there's a band like this. We get ours from Perform Better. You can get these at Dick's, anywhere that you can get sporting goods basically now. And we're going to take this and we're going to wrap it around our knees and begin to do some band walks to work to strengthen our hips. So it's going to look something like this. We'll wrap this here around our knees. We're going to sit down nice and low. And what we're going to do is we're going to step and replace. Step, replace. Step, replace. Step, replace here. And then we're going to go back the other way. Stepping and replacing. Now, if you don't have a ton of room, you can step and bring it right back. Step and bring it right back here. So those are a couple ways that you can work to reduce the pain that you have and the inflammation in your IT band, but also to prevent that injury from happening if you don't have it now, or prevent it from reoccurring in the future. Thanks a lot, guys.